Hello, it's Dr. Tom Nacella from Strategic Chiropractor and strategicdc.com. And today I want to talk to you about some good news regarding Aetna's policy on chiropractic and manual therapy. Maybe. So if you have been following this blog or my articles over the last several months, you've probably read about Aetna's medical policy decision to deny payment for manual therapy, that is the CPT code 97140, and your chiropractic adjustments, specifically 98940, 41, or 42, when these services are performed on the same day. If you haven't read about that, check back for our previous articles on Aetna denials for manual therapy. Anyway, this policy, which began rolling out late in 2012, went into full effect nationally on March 1st, 2013. And what it did was it rejected proper coding and documentation rules entirely in favor of sweeping denials. In other words, it didn't matter to Aetna whether you applied Modifier 59, whether you performed the work in a separate anatomical region, and or correctly documented these procedures. A denial would result no matter what. But wait, there is some more news, and some of it's positive. Recently, the American Chiropractic Association's Insurance Relations Department held a meeting with Aetna representatives on May 16, 2013 to discuss their new policy on manual therapy. According to Aetna's internal audits, they found that 90% of the time 97140 was billed, manual therapy was performed in the same region as the chiropractic adjustment, which is incorrect. This led to their policy decision to deny all 97140 services when billed on the same date of service as chiropractic adjustments. So here's some good news in part. While Aetna's official policy is still to deny all 97140 services when billed on the same date of service as your adjustment, Aetna has agreed to allow providers to appeal this and to submit documentation to request payment. Appeals are permitted retroactive to March 1st of 2013 when the policy became effective. So you have a chance that you can get paid. Of course, to merit payment, chiropractors need to have their documentation, billing, and coding correct, and you have to go through the extra step of appealing the claim that should have been reimbursed in the first place, at least according to proper CPT guidelines. But if you're sitting on denials for hundreds or thousands of dollars of Aetna claims that got denied because of this new policy, and you know you've done things right, then you have a chance to get paid for the good work that you do. Certainly, appealing is not ideal and it takes time, but it may be worth it depending on how much money is at stake in your case. Now, there's one last bit of potential good news. In the meeting with the ACA, Aetna also indicated they are willing to completely reverse this policy if improvement is shown. So be sure you're properly billing, coding, and documenting these claims. If you need to know how, see our previous post on Aetna's policies on chiropractic adjustments and manual therapy, which contain the 4 required steps to do this correctly. All right, I hope you get paid for this work that you've been doing. This is Dr. Tom Nacella, Strategic Chiropractor, and we'll see you next time.